gonna get on, do this.
Not scare him, get you all sorted, all right?
John? Do you remember where you are?
King's College Hospital, London.
Thank God.
A major trauma centre.
Hit the curb, jackknifed onto the verge.
Have we got a good pulse? Have we got an output?
And one of the busiest A&E departments in the world.
He will probably scream, but he won't remember.
No, stop! Ah!
A place where love,
Come on, sir.
Let's go.
Up you go.
No.
Yeah.
life,
There you go.
I love you.
I love you too.
and loss
It's all right.
unfold every single day.
Don't cry. And we'll make sure Mummy stays with you. Well, listen.
Right, who's not busy? Squeeze that.
We can't give up on her, come on. We've got to be strong for Mum, if it is the last bit. Hey.
All the patients you're about to see were treated in one department.
Well done.
In just one 24-hour period.
I never cease to be amazed at the robustness of human beings.
I love you.
And the strength of their relationships. Love, it's a reflex. It's what you do. For many of the families, despite the devastation that they may be facing, they give unconditional love.
I've got trauma, I've got stroke. Well, in half an hour's time, you'll be on your way out, aren't you?
You live in Peckham? Yeah, go to working in center. There's no waiting in there. That little sore throat can be dealt in the area. Okay? You're welcome. Bye-bye. We give all this information to the patient, so you need to be assertive. Yeah. You need to be firm.
It happens in any career, that you've gone from being the new kid on the block, you know, not knowing how things work, to the ones that people look to.
I think that's two things, experience and common sense, isn't it? Do you agree with that small little thing?
Yeah, I kind of do actually.
Yeah.
Experience is like massively important.
Yeah, experience is a good teacher.
Senior nurse Scott has been at King's for 13 years. Today he's in charge of all 10 beds in Resus.
Hello, Charmaine.
Hello, nice to meet you.
I'm Scott. This is just your first shift in here, first day? Yeah. I noticed the scared look.
You just sort of have to look and take everything in though, don't you?
Yeah, that's fine. Don't be afraid to get stuck in. There was another student at another time on a night shift. So I'm like, have you ever done CPR before? She's like, no. I said, right, you're going to do some CPR now. Okay. She jumps on and she's pumping down on his chest and his blood shooting out these holes. And I'm like, we stop it after 3 minutes. And I turn around and I'm like, oh, was that all right? And I could see her kind of filling up. And then it occurred to me, and I just went, have you seen a dead body before? And she went, no. You forget that people have a first time.
Okay, thank you. Bye. Fall for about 3 metres, head injury, LOC, GCS now 15, facial injury, C1, C7 tenderness.
Hello, everyone.
Hello. Hello. Pay attention.
Get you oversleep.
Mum of 2, Pauline, had a fall at home 40 minutes ago.
Pauline's 56, had a mechanical fall at 10:30 this morning. She fell down 5 steps, landing on the table. Pauline does not remember the full events.
Lovely. Thank you very much. Yeah. Okay.
Fine for you.
Okay, we've got 5 minutes for a primary survey. The first 3 minutes are gone. I haven't heard anything. Let's go.
Hello, King's College Hospital.
Wow, okay.
Hems, red phone, 20 minutes. Hems, red phone, 20 minutes.
The air ambulance is bringing in a 62-year-old man. He fell off a roof, head first.
Right, Mary Jane, just so you know, I'm sorry. Here we go.
Okay,
I'm going to get someone to take 7 to CDU. 5's going to go around to major cubicle 8. 3's going to go to minus cubicle 2. And then that gives us a bit of space. When you've got a full resus where you're completely rammed, but something else is coming in and you need to fit that in and you've got 5 minutes to do it, you've really got to fire off a lot of big decisions in a very short period of time. Can we urgently have a porter to resus to move some patients, please? Thank you.
Excuse me, if I want to go to the toilet, can I walk right now? No? No.
There's 3 of you here that it's waiting.
They're all going to fight for one bed.
Okay, we'll have to split this trauma call off a little bit. How many orthopedic surgeons I've got? 2. Can I leave you with this one there? So what we definitely need is C-spine, CT head. Happy? I'll leave you to it for now. We'll do the other one.
Right, surgery.
It's here, it's here.
Orthopedics.
It's here.
Anaesthetics.
Stand in for him. It's here.
Yes. Do what I tell you, you'll be absolutely fine. Right. Put some gloves on and an apron. You're helping.
So that'll be Hems from the park. So Clem, just to give you an update, 60-year-old male has severe head, chest and abdominal injuries, is cardiovascularly unstable and intubated and ventilated. This is this patient, yeah.
We're going now, are we?
We are just going to take you next door. There's somebody quite sick coming in, so we have to make a space.
Oh, it's okay, yeah.
If you want to get hands on, do. If you just want to stand back and watch, I'm not forcing you to do anything you don't want to do.
I want to get in there, but I don't want to get in people's way.
You won't get in people's way because you'll be told to get out of the way. As soon as he rolls in through the door, he's attached to blood. So we could be looking at chest drains, we might even open his chest, or we could be looking at just, there's nothing we can do here. He might already be dead by the time he gets here. Can everybody else sign in that's here before we start, please?
A 62-year-old man with life-threatening injuries has been flown in from Sussex. He fell to the ground while working on a roof.
It's a very time-critical situation. A fall from height, the 2 big things you're looking at is a head injury and a chest injury. Straight up in here, guys. We'd heard that he'd fallen into his head, so in the back of your mind you're thinking it could go either way here.
Okay, so it's on Mark's count. He's got the tube at the top.
Okay, we'll go on ready, brace, lift. Ready, brace, lift.
Coming out.
Okay, we're all ears, thank you.
Hi guys, this is David. He's approximately 60 years of age. David has had an unwitnessed fall 30 feet off a roof, landing on concrete. Injuries top to toe. He has a traumatic brain injury with a right parietal hematoma. He has chest injuries with suspicion of bilateral rib fractures and concerns of intra-abdominal bleeding.
Okay, thank you very much. Okay, first of all, I want the blood connected in cardiothoracic surgeon, 2 chest drains in the thoracostomy. Primary survey, we've got 5 minutes. Come on then. Ventilation, Jenny. Blood is being connected, yeah?
Peggy, that's me. Okay. Okay, chest drain, please. And just some 10 silk, please.
Since arriving, David has been given 3 pints of blood.
Good. Primary survey plan. Blood being taken, blood is coming up, chest drains in, and we should be ready to go for scan very shortly.
Barbara, do we have any details for him, name-wise? What?
Yeah, come on, so we've got
David Beck. Okay.
Okay. Are we almost ready to go to scan? From an airway point of view, yes, we got drugs. Okay, let's go.
He went to work
as normal. She used to fit aerials and satellites up on the roofs. He gave me a kiss goodbye, and I always give him a kiss and say goodbye and, you know, have a good day and all that, and I didn't this particular day. I was always saying to him, it's about time you give up. But no, he wouldn't. He loved it. Got a phone call. Police car pulled up. And he sort of said, Mrs. Beck, I said, yeah. And he said, oh, we're taking you to London. And I honestly, truly thought he was already gone.
Little happening. I mean, they're not busy, are they? No. That'll be a young doctor arriving. And I don't know what the delay is. You know, it's not busy, is it?
Well, we don't know what's going on behind the scenes there.
Don't the people have to be here first?
True.
To go on behind the scenes?
Certainly this can't be sorted out in the next couple of days or so. I'm going to be very handicapped.
Yeah, there'd be two of us. I might have to put off my off.
It just seems sad.
I haven't got a space or a nurse. You just wait there for 2 minutes. I'm getting both. Oh, lovely. Tess, number six. Tess, can you just take this new one? Status.
Okay.
Lovely. Thank you, Tess.
Well, his CT is going to be delayed, isn't it? Unless we find out when it's because they're going to be chocker with these two now. The CT.
56-year-old Pauline's been given pain relief. She's now waiting for a CT scan to show the extent of damage to her spine and neck.
Just arrived status.
Yeah.
Just needs to go into CDU. Medics. Just arrived, gone to AAU.
Okay.
Yeah. Thank you.
I think no, that's I know.
Hello.
How's your neck?
I don't know, because they're giving me
Morphine.
Yeah. Don't cry, baby. I'm such a numbskull. Please don't cry.
You worry me, Papa.
I know.
You do worry me.
It just happened so quick.
The accidents do happen quick, though.
But all they did was go up the stairs and I missed my footing and hit the table. Don't cry, please. Please. I'm fine. Don't cry.
Can't help it.
Don't. I was just so frightened because I was on my own.
Well, she's a bit accident prone. Tripped in a manhole cover and broke her foot. She ran across the road, tripped and fell onto the pavement and fractured her wrist and broke her elbow. And then this time fell up the stairs, hit her face off the table and smashed all her teeth out. It's emotionally draining. Well, I keep trying to tell her that, you know, just slow down. You know, you're getting old now, you're older, and just slow down and try and take things easy, you know, rather than dashing across the road and falling over and
falling up the stairs and, you know, all the stuff that's happened to her. Yeah, it's been a bit scary. I hold her hand more often now when we go out.
Have you seen the bottom teeth?
No, I don't particularly want to.
Oh, man. It's just my teeth.
There's not many of them left.
When is it ever going to end, Bob?
Soon, I hope.
Can you get me some decent underclothes, please? They've cut all my underclothes.
Okay.
They cut all my shirt. It's 38D.
Oh, just get some stuff.
Yeah, please.
38D.
38D. Yeah.
All right, I'll go and see her. I'll be waiting. I think you make your marriage. I don't believe in love at first sight. You know, I don't think you grow to love someone.
Yeah, he has got nasty contusions predominantly on the right side with a large temporal fracture on the right side, bilateral orbital fracture and also a temporal fracture on the left side.
David's head took the full impact of the fall. The CT scan will reveal the level of injury to his brain.
We've got two boys. They're now 37 and 36. We always used to like going to Cornwall, Devon. We had our own caravan, so we went touring. And the boys thought that was, you know, the bee's knees.
So important is now to see if he's got other injuries or bleeding from somewhere. If not, and if it is an isolated head injury, then it's very important to maintain his blood pressure relatively high to make sure he's getting enough cerebral perfusion pressure up there, because this brain will, over the next days, swell up. So this is now our task.
I don't think you could actually say after 42 years that I'm in love with him, but I love him. It's for better, for worse, really. You know, that was in your vows. It's strange, isn't it? You know, I think it's like partnership in the end.
Right, you're going to roll you again. There you go. Madam, you can sit in one of this chair.
Opera critic John injured his ankle while on a skiing holiday.
Right, you're John Bakan, is that right?
That's right.
And how young are you now this time?
I'm 78.
Right, good. Right, how can I help you today, mister?
Well, I found the second morning running that my left ankle is so sore that I can hardly put any weight on it.
Right, okay.
Fall in love, don't forget we were in our 30s, you know. It wasn't romantic love, oh, here's the love of my life. It was just a very interesting man and very charming, very easy. He asked me to go to an opera, the English version of Wagner opera, and we've been going to music ever since. I've been married to John for 42 years. So we tried massaging it a bit with oil, and did not make the difference it made yesterday morning.
So you're being oil massage?
Yeah.
And pain relief?
Yeah.
He didn't take any pain relief.
Sorry, I didn't take any pain relief.
Oh, right, okay, just a massage.
Yeah.
She wear the trousers, do you think?
Yes, I think probably she wears 1.5 of the legs of a pair of trousers, yes, I'd say so.
Do you have any medical problems, sir?
Yes, I'm suffering from prostate cancer. That's being treated.
It's got out a little bit of it onto the pubic bone.
Yeah.
So he's on female hormones.
Okay.
Casodex. Daily.
Many men die with cancer rather than of cancer. And that seemed to me a fairly encouraging thing to keep in mind. And I never had any pain, so I've been lucky, perhaps.
Just stay on the chair.
Yeah.
And someone...
medicines, if you need to know them.
Oh, we got simvastatin as well. We got blood pressure. We got cholesterol as well. The way I look at it.
Cholesterol is under control.
Good. Plus your diet, I think. You need to get your diet
the
done.
diet, we eat extremely well.
You need
And
to limit your level of oil, basically.
The only thing he takes too much is red
fish is
wine.
less oil.
That's all.
My husband would say that I rule the roost. In everyday matters, there's absolutely no doubt. You know, he's not interested enough, really.
Right, sit you back to the waiting area.
Okay.
But with my husband, it's not a matter of let you do, really, is it? You know, you kind of accommodate one another, don't you?
Right, I'm going to get something to eat. I know you can't have anything, so I'll eat it out there.
Too right, you will.
Okay, I won't be long.
Don't kiss me.
There is kiss you, don't be silly.
I mean on the lips.
Yeah, you're having a laugh, isn't it? Wait a minute.
Have you had any relatives at all yet?
Apparently there's a wife who is being blue lighted in by the police. She's expected, yeah.
So should we send her to surgical critical care if
I think that would be very good.
Yeah.
We would talk to her there.
Yeah.
Thank you. That'd
Mo
be
Jane,
good.
did you get that as well?
David's CT scan has revealed significant injury to his brain.
He's obviously sort of gone like that, hasn't he? And sort of as he's landed, sort of
and
gone
slipped a bit
more like
further
that.
on there.
Yeah. But I'm surprised his chest. Isn't it?
Chest is,
It's
yeah.
not even a rib, well, not an obvious rib fracture, I can see. Gosh, well, gosh, that's an hour really from getting here into scan and back out again. It's
not bad,
I've seen some people fall from great heights and bounce. I've seen people that have fallen from standing and had a big bleed. But usually, the higher up they've fallen, the more chance you've got of them having some brain damage. Once you've stabilised the patient, there's not that much more to do for them.
He was on a life support. He was in a coma. We all moan about our partners, but you just don't realise until something like this happens.
I can't believe how quiet it is. I can't believe how quiet it is.
Yeah. This floor's a bit cold.
Oh dear.
So I can't get my shoes. I've got shoes there, I can't get them on. All swollen. I put my coat on the floor. Getting chilly now.
How can I hide your Daniela?
I'm going to Jamaica tomorrow.
Oh.
Say hello and goodbye.
For how many? Like a month?
Just for a
With
week.
your girl boyfriend?
I hope so.
Enjoy your holiday. All right, enjoy. Oh, I love it, that Daniela. It's one of the FY2 doctors. It's quite sweet. You got a boyfriend?
No.
Really? Yeah, good girl. Continue with your studies and the rest will follow.
Sounds good.
Yes. Hello.
Oh, yeah.
How can I help?
But I'll be next nurse, you know.
You're next, yeah.
A very, very fit man. Just finished with the army in 1952, April 52. And it was, I went down to get a job, you know, at the Labour Exchange, and they turned around and said, "We ain't got no job for you." I thought, that's tasty. I said, you know, I've been out there for 2 years, right, doing your bit and pieces, whatever it was you had to do. I said, when I come back, there's no work for me. I said, I tell you what, don't bother. I said, I'll go and get my own work. And I took to window cleaning like a duck to water. I was really fast. You don't stand going like this, clean the way. Come, finish, next job. And that was it, you know.
Don't lick, darling.
Don't lick what?
Don't lick your lips. They'll get drier and drier if you do that.
No,
You know what? Maybe you should have a lipsil in your pocket, but you'll just lose it, won't you?
Yeah.
Stick some on now, though. There. Put some on. See? That's better, isn't it? Yeah?
Mm-hmm. She's probably cared for me better than I've cared for her. She looked after me pretty well. I'm sure it's partly due to her that I'm still around today.
Darling?
Yes?
Your feet are not your best part, darling.
No, I know. Not much of me is my best part.
Well, your smile is lovely if you only had your teeth, you know.
He sort of doesn't really focus on his cancer. There is a danger, and that's, you know, always there. If you're awake at night, it will worry you, or if you're having a reflective moment, it will worry you. But in our kind of normal, busy lives, no, we don't let it. And John is a sort of optimistic man. That he would.
So it's more around your ankle.
It's yes, around here.
Classical textbook sprain.
Yes, I bet that's
So it sounds very much on what happened to you.
We have good times and the not so good times, and you work through them together.
King's A&E. We're getting a little bit full now. Go ahead.
Charmaine, do you want to start putting these on?
Red here, yeah?
Yeah.
Then black underneath, isn't it?
That's it.
It's 10. Lovely. Thank you. And another one. Okay, go on.
You've done very well being stripped down for such a long time.
It's this that's given me...
Oh, right, yes, it's very dry. There's a bit of crusted blood around there.
The results from Pauline's CT scan are back.
Did you say it was
There's one crack in the bone. Right. It's a bit further up, a bit higher up than the coccyx bone. Right. We call it the lumbar region. All right. Lumbar spine. Yeah?
Yeah.
And there's no specific treatment for that apart from taking painkillers, really.
Yeah.
Right.
Yeah.
Should we have another look at the back
Exactly.
then? Would that be right?
They found another fracture. Yeah.
So I've got a bit of a bad track record. I've just got to take things a bit easier. It's not fair on John, you know, because he tends to worry about everything I do.
I'm just a bit stiff.
All right.
I class myself as being very lucky. And I often think I put him through too much. And I don't think it's fair. He's an angel. I wouldn't be without him.
Is it Mr. Runcorn?
Yes, it's me.
All right, would you mind coming through this way?
Yeah. Anyway, see you.
Oh, okay. All right, come through this way. You don't seem to have any shoes.
I know, I couldn't get them on. All my feet are swollen.
Okay. All right, do you need any help?
Yes, please, with legs.
Let's get those legs up onto the bed.
Oh.
Oi, well done.
Oh.
Right, well, very nice to meet you.
Thank
My
you.
name's Josh, I'm one of the doctors here.
Oh.
So tell me what brings you into the emergency department today?
I've got swollen ankles to start.
Mm-hmm.
Okay? And my private parts, you know, I think maybe you've got a blockage there somewhere.
Okay.
Also, I've got, I can't go to the toilet. What's it called?
Constipation?
That's it, yeah.
Okay, so three things today.
Yeah.
You got family?
Yes, I've got 2 sons.
Are they
And my wife died Boxing Day.
Boxing Day just gone?
Just gone, yeah.
Oh, sorry to hear that.
I met her in 1950. Father was a right sticker, I tell you, you know. But one day, she was indoors crying her eyes out. I said, what's happened to you? She said, my dad hit me last night. Well, I said, it'd be the last time he'll ever touch you. Because I went man after him. I said, if you ever lay a hand on her again, I said, it's going to be your lot, my friend, all right? Believe me, I was really annoyed. I said, I'm going to marry her shortly, all right? And that was it. He packed it up after that. Never touched her after that. Yeah, the 58 glorious years, no problems.
Fantastic. You don't see that so much these days.
No. Well, I got married on the 3rd of August, 1952. I was waiting at the bottom inside the church for her, you know, and her father brought her in. Then he brought her down the aisle, you know. I never seen him move so quick. I thought he might change my mind.
Had she been at home with you, or?
Oh no, she was in a private a nursing home just round the corner from me. You know, beautiful place.
Oh, what a terrible Christmas for you.
Yeah, but it's released for her. She had dementia, Parkinson's.
Oh. Right, we're just going to pop this line in.
Peggy was ill. She was about 70. In the beginning, I used to, when she really got bad, I used to dress her, everything, you know. Give her a stick wash. And she got to that stage where she didn't hardly recognise you, you know. So I said, right, enough's enough. I said, don't give her no more oxygen. I said, she's been through enough. I said, just let it take its course. And me and Robert was there. We both held her hand, you know. And that was it. She went away peacefully and had no pain.
Who does all your cooking for you?
I do it.
You do it yourself?
Yeah.
How's your chefing skills?
It's all right.
Right, we'll just get that X-ray done next. Okay. They'll come and get you though, so you just relax here for a bit.
Okay.
You're warm enough like that?
I'm fine.
Good.
Thank you.
And that's your water.
Yeah. Hello there. All right.
Yes. just want to go over there and look after him. The old man. I know, I hate leaving him in the room. I want to go talk to him. How did our granddad used to feel, man? He might feel the same. It really hurts, man. We was with Grandad most of the time, because he lived up literally the top of the road from us. I used to come home and I used to dance with my granddad round the sitting room to all Frank Sinatra and Perry Como and all things like that. He had a stroke. He became ill. I started to take up care for him. I gave up dancing, college, social life. I think that's what I might do. With old people. Don't think you'd have the patience. I don't know. It's not something that's easy, trust me. You see so many people go, it starts fucking with your head. Doing care work, it's not really the life of a teenager, is it? But that was my life. Just had to kind of deal with it, and I enjoyed it, so I didn't really...
Didn't feel like you missed out?
Nah. I feel like I'm missing out now my granddad's gone, because I don't really have that routine no more of I've got to do this and I've got to do that, and it's like I ain't got that smile no more to look at when I come home, and I miss it. He deserved everything we did for him, and I just thought it was my place to take up because of everything he done for me.
He was very lucky to have you.
I was lucky to have him.
Is this the trauma one? The fall down the stairs. It's up in 5, but I'm not sure if the bay's ready yet. We've had a bit of everything close. Are you right?
Cardiac arrest, which means we'll have to 4 weeks. Which is...
A lot of the sisters are amazing. Their knowledge is just... It's not a patch on anything.
But then I just think, sometimes, am I ever going to get to that level? Like, obviously you will.
Traumas are reasonably simple to look after. If you're trained right, it's exciting, it's gory, it's the stories you take home. But if you want to be a proper A&E nurse, you know, show me how to look after a really good chest pain, sort out an asthmatic, being able to manage a good miners area, sit out and triage for 12 hours and triage 140 people and get it right all the time. Good A&E nurse is an all-rounder.
Thanks for a lovely birthday.
Yeah. Make sure you come back for a second one.
Alfred's X-ray shows no significant problems. He'll stay in overnight for observation.
Alfred, have you got any family that live near you?
No, only my son.
So you don't need any help at home with anything?
Oh, no, I'm fine. I do everything from...
You're absolutely fine at home,
Yeah.
and then if you need any help, you can just ring your sons, can you?
Okay.
And they'll...
Oh, yeah.
Yeah?
Yeah.
You sure?
Yeah.
Okay.
can cook, sew, iron, all the jobs that a woman can do. Yeah. The times I've heard some people, oh, I wish I had you for a husband. Oh, I wish I had you. But you can't have me, I'm spoken for. I have a wonderful life. Yeah. I know the carers are very, very good, right? But I like to have it my way. You understand what I mean? It's got to be my way, right?
If we just wait on the chair there, I'll see if a porter can come.
Okay.
And then we'll take... Yeah. You're walking quicker than me, though. All right, just leave them there.
Yep.
And I've got a couple of paracetamol for you up here. There you go.
Was that then?
Just paracetamol.
Okay, fine.
All right?
Yeah. Sorry? Oh,
Didn't say nothing, darling. My granddad passed just like literally before my 18th. It was like, is it my turn now to be the adult? Is this where it's time to choose my path? Because I'm 18, Granddad's always told me, don't do this, don't do that, go and do this, go and do that, and he'd always advise me, and it was like, well, now I've got that option, what do I do? I learned quite a lot from my granddad. I think I got a very old soul.
We're off.
Okay.
Oh, can I pop them on your lap? Is that all right? All right?
Yep.
So much stuff, haven't you? Mobile chemist.
I know he's up above watching over, so I'm blessed.
Are we going to wait in reception?
No, we're going to wait just out there.
What, in the cold? What? Oh, it's cold.
Right. So just like the party, I'll be the last one here. For fuck's sake.
Everything that happens to me daily is new to me, and you work with it or work round it or whatever. I just want things to be normal, but it won't happen. I know that, and people have told me that. So only time is a healer, isn't it? Being with Pam, it helps me immensely. I couldn't do without him, I'm sure.
He's infatuated with me now. I'd sort of say to him now, I like going to bed. You know, if you're tired, go to bed. No, I'll wait until you come to bed. He won't do anything on his own without me now. Which is sometimes, I think it's nice if I could have a quiet 5 minutes. Even an hour.
Camberwell. I do private jobs as well, as regards cleaning. I've been going there 30 years. They think the world of me and don't want to get rid of me. I threaten to leave them, really. You're not going anywhere. You're not going nowhere. But I've had enough. You're not going anywhere.
Hi everybody, Wayne. He's been stabbed twice in the left thigh.
As a parent, all you want is for your children to be happy and healthy. You may not even be back tonight. You have one tumour and then you're told it's gone, and then it comes back.
With your track record, we have to assume the worst and hope for the best.